COXS BAZAR, Bangladesh. The medical team from Malaysia that will operate a field hospital for Rohingya refugees here expects to receive a high number of maternity cases involving rape victims. A medical specialist in charge of setting up the 50-bed medical facility in Ukhiya, near the Kutupalong and Balukhali refugee camps, said the team of 50 health ministry, medical and support staff includes specialists and psychiatrists to provide treatment for the women and girls who fled persecution in Myanmar's Rakhine state. The Defense Ministry's epidemiology clinical specialist Colonel Dr. Marshal Moideen, who is the chief technical advisor for the project, said he received reports of many female refugees being brutally assaulted. He said this contributed to hundreds of thousands of Rohingya Muslims being forced to cross into Bangladesh to seek refuge. From the situation on the ground, we expect to receive a high number of cases, especially for gastroenteritis ulcers due to the refugees' unsanitary living conditions, as well as maternity cases due to the fact that many of the female refugees are victims of rape. The team here will provide specialist care, including psychiatric care, to treat the traumatized rape victims, he said during a briefing to 13 members of parliament who visited the camps and hospitals site on Saturday. According to reports by United Nations Office for the Coordination of Humanitarian Affairs, between 100 and 400 Rohingya women and girls in Rakhine state become victims UAL and gender-based violence on a weekly basis. The office on its website stated that the Myanmar military has been accused of using rape as a weapon against Rohingya women and girls. Meanwhile, on the progress of the field hospital's construction, Dr. Arshal said it is expected to be completed on Monday, ahead of its commencement of operates date on December 1. During the visit, the MPs were briefed that the facility will serve as a referral hospital for serious illnesses and medical cases. This hospital will be the most complete facility at the refugee camps, with services provided at par with the district specialist hospital, once it is up and running. It will also receive patients who are referred here by district hospitals around the area. The hospital will be able to provide specialist care including surgery and treatment for infectious diseases, said Dr. Arshal in the briefing to the MPs, led by Dewan Rakyat Deputy Speaker Datuk Seri Dr. Ronald Kiindi, who spent about 30 minutes overseeing the construction works. Dr. Arshal added that the team had also received a request from the Bangladeshi government and the United Nations to consider extending its operations there to at least a year. Earlier, the elected representatives from Barisan Nasional, PA and PKR visited the Balukhali refugee camp, which currently houses 621,000 Rohingyas. They spent about 3 hours observing the refugees' living conditions and delivered basic necessities and blankets to 300 families. In his speech when launching a Malaysia-sponsored madrasa at the camp, Deputy Transport Minister Datuk Aziz Kaprau, who is Sri Gading MP, told the refugees that Malaysians will always be there for them. He said the Malaysian government carries the aspiration of its citizens who want the Rohingyas' rights to be defended. Our Prime Minister took the issue of the Rohingyas up to the U.S. President. We will be with you until the end, he said. The MPs, together with delegates from the NSC, the National Disaster Management Agency (NADMA), the Transport Ministry and the Office of the Deputy Prime Minister, are on a 2-day visit to COXS BAZAR for a first-hand look at Rohingya refugee camps, which are the largest in the world. The other MPs in the group are Datuk Nur Sanadin Moharun Narashid Bien Kota Tinggi, Datuk Dr. Nur Azmi Ghazali Bien Bagan Sarai, Datuk Ago Anak Dagang Bin Akanawit, Datuk Rami Ungi Bintenam, Fuja Salapi Kr Kwantan, Cities Ilamo Yusuf Pas Rantau Panjang, Datuk Dr. Nick Mazi and Nick Mohammed Pas Basar Puda and Datuk Kamrud and Jafar Pkr Tumpat.